Good afternoon. Welcome to the CDP webinar, COVID-19, Managing Multiple Disasters Amid the Pandemic. This is Sally Ray, Director of Strategic Initiatives at the Center for Disaster Philanthropy. This webinar is provided with generous funding from Verizon and is co-sponsored by Interaction, National Voluntary Organizations Active in Disasters, the Council on Foundations, the National Center for Family Philanthropy, Grantmakers in Health, Grantmakers in Aging, United Philanthropy Forum, and the Funders Network for Smart Growth and Livable Communities. Some reminders before we get started. This webinar is being recorded. It will be available on our website and YouTube channel shortly after the webinar is complete. All registrants will be sent a link to the recording. You can submit questions at any time using the Q&A box, and they will be answered at the end of the panel presentation. If you are on Twitter, please use hashtag CDP4Recovery to share the discussion. I want to take this opportunity to announce that CDP made a third round of grants last week through its COVID-19 Response Fund. Last week's grants totaled $1.75 million, and the grantees are Enterprise Community Partners, Lutheran Immigration and Refugee Services, National Alliance on Mental Illness, or NAMI, Oxfam America, Plan International, Project Hope, and Save the Children. We also co-funded Doctors Without Borders work in Venezuela and Yemen in conjunction with CDP's Global Recovery Fund for an additional $100,000. NOAA recently released its spring flood outlook and indicated that a third of the United States is at risk of flooding this spring, affecting 23 states and 128 million Americans. AccuWeather forecasts a normal to slightly above normal number of tornadoes in 2020 with a range of 1,350 to 1,450. That range is close to what occurred in 2019, and it is 5 to 15% more than the US annual average. The 2020 Atlantic hurricane season starts on June 1. Early models created by Colorado State University predict 16 named storms, including 8 hurricanes. 4 of these hurricanes are predicted to become major storms or category 3 to 5. Conditions in the Gulf of Mexico are similar to 2017, which brought us hurricanes Harvey, Irma, and Maria. The wildfire season will also be intense. Predictions indicate an above normal and significant large fire potential for California, Washington, and Oregon in July. Since this is an unprecedented time, the combination of a pandemic with tornadoes, floods, hurricanes, wildfires, or other disasters will also be unprecedented. In his 2009 book, The Black Swan, The Impact of the Highly Improbable, Nicholas Taleb said, "I know that history will be dominated by an improbable event. I just don't know what that event will be." I suspect that we have found Taleb's improbable event. This webinar is designed to help the funding community continue to understand how to be prepared for the unexpected. Our discussion will cover the role of leaders and leadership in managing crises. How do we plan for response to other disasters amid COVID-19 response and recovery, given the new limitations? What does effective disaster philanthropy look like for new disasters when also grappling with the unknowns of the pandemic? And the balance between relief and recovery dollars. Now I would like to introduce our guests. Dr. Leonard Marcus is the founding co-director of the National Preparedness Leadership Initiative, NPLI, at Harvard University. His work has been extensively applied to complex organizational transformation, crisis leadership, stakeholder negotiation, and conflict resolution. Dr. Marcus has been on the faculty of the Harvard T.H. Chan School of Public Health since 1995 and is co-author of a new book, You're It, Crisis, Change, and How to Lead When It Matters Most. Regine Webster is founding executive director and vice president here at the Center for Disaster Philanthropy and leads the grant-making and consulting teams. She has more than 2 decades of disaster grant-making experience at CDP, the Bill and Melinda Gates Foundation, Arabella Advisors, and the Conrad and Hilton Foundation. Welcome, and thanks to both of you for taking time away from your work to speak with us today. Lenny, let's start with you. Your work at the National Preparedness Leadership Institute is based around a framework you call the dimensions of meta leadership. Please tell us about it.
Well, thank you. And thank you to all of you who are listening on this webcast. So we've been studying crises since the inception of the NPLI right after 9/11, and we study these crises by being with leaders in the midst of a crisis. So I had the opportunity to be with Mike Brown, FEMA director during Katrina, with Admiral Thad Allen during the Gulf oil spill, and Dr. Rich Besser when he was the acting director of the CDC during H1N1. And we put together the best practices that we've seen into a model of crisis leadership that we call meta leadership. The prefix meta meaning looking very broadly at problems, looking very broadly at solutions. And the dimensions of that meta leadership start with the person, who you are as a person, and your ability to, in the midst of a crisis, to get out of your reptilian brain, what we call get out of the basement, and then help to other people to get out of the basement so you can really understand what needs to be done and what needs to be led in the midst of a crisis. So the first dimension of meta leadership, the person, right in the middle there. Second dimension of meta leadership is the situation. And that is based on the notion that crises are complex events. There's a lot going on. There are many stakeholders, big consequences of any decision that's made. So we teach leaders how to first analyze what's going on through the context and lens of complexity, and then make decisions and communicate and operate in the context of as an accurate and changing analysis of the situation as possible. And then the third dimension of meta leadership, connectivity, and that's bringing people together, leading in multiple directions, and first leading down to the people who call you boss, leading up to your boss if you're a subject matter expert, or leading up to a mayor or a governor or president, board of directors, and then leading across, first across within your own organization and agency, and leading beyond to build connectivity of effort across many different organizations. When you do this at its best, you'll be able to achieve what we call swarm leadership. It's based on our analysis of the leaders during the Boston Marathon, where they really brought the community together like a swarm, those innate qualities that we have within us. And when you're doing that, everyone turns to one another who's part of the crisis response with the notion of how can I help make you a success? And if you can bring that into a community, bring that into an organization, a business or government agency, then everyone is working in the same direction. That is the essence of what meta leadership is all about.
Am I the only one who's lost Dr. Marcus?
I'm here.
Okay, sorry.
So, and I can go on to talk about a book we recently wrote about this called You're It. The title of the book is You're It: Crisis, Change, and How to Lead when it matters most. And the notion of the you and your it is responsibility. And if you're a leader in a crisis, then it's critical that you assume that responsibility. You has two meanings. First, it's you singular, you the leader, and then how do you assume that responsibility? And then it's you as a collection. So a leader turns to the group of people looking for, are you able to hear me? Hello?
Yes, we can hear you.
Yes,
Okay.
yes. I'm
Okay,
sorry.
good.
Yes, I can hear you.
Okay, great. So the you also is the collection of people that are looking to you as a leader. So you, all of the people in our agency, all of the people in our organization. What's critical, and as we're studying the leadership response to COVID-19, we recognize that there are a number of lessons that we have to derive from this. In part, it's the lesson of science, the virus and the vaccine. In part, it's the lesson of supplies, the national stockpile, et cetera. Very, very importantly, it's important for us to grasp the lessons of leadership. Leaders make decisions. Those decisions have impact on communities. They have impact on the trajectory of this virus. They have impact on social equity. So it's important for leaders to recognize you're it. You do have that responsibility, and it's critical for you to assume that responsibility. We believe that leadership is not something that you simply have. It's something that you have to work at. You have to train yourself. You're disciplined as a leader, and you understand the consequences of that leader. What I'd like to introduce now is what we call the arc of time. When we were doing research on Hurricane Harvey, and we did that research, again, embedding with leaders with the leadership of the American Red Cross in Washington area, with leadership in the Houston area as well. What we recognized is that they were, in the very beginning, coping with and responding to Hurricane Harvey. And there was an arc. That arc of time, that event began. And of course, the consequences, the threat and challenge of Harvey went up. And finally, it was at that peak of time that where we're in the middle of the hurricane and we were understanding what was going on. And then the activity began to subside. We call that an arc of time, so that we respond to a crisis over time. And if leaders are able to understand that arc, it gives them a way of understanding what must be done now, what happens in the moment, what's been happening, the was, and what will need to be responded to, the will be. So time, when you're thinking about the wide view of leadership, that meta leadership, time is an important element of that crisis. And of course, what was fascinating for us as we were studying the leaders through the hurricane season of 2017, first was the arc of time of Harvey, then was the arc of time of Irma, the arc of time of Jose, and the arc of time of Maria. And these different arcs of time coincided with one another. And the complexity for leaders through those events was they were ramping down on one crisis and they were instantly ramping up on the next crisis. So we can go to the next slide, and this will give you a sense of the work that we're doing right now. If you think about today, we're right at the end of April, May is about to begin, and we went through that first arc where there was sheltering in place, social distancing strategies, and that first arc that started around March 13th when the national emergency was called, and we're beginning to come down that arc. We're seeing that we're now just beginning to transition into that next arc of time. The cases are leveling off. The tolerance for sheltering in place is waning. People want to get back into business. So we're beginning to move up that arc of time in many ways, state by state, depending on the cases in that state. And then we can track that this second arc of time is going to be moving then to the point where we have a significant lowering of cases, and we'll be able to open up more and more businesses, potentially opening up other social agencies, churches, schools, etc. So what we're doing is then analyzing these different arcs of time. If we go to the next slide, you can see, and we won't go into detail on this, that if then we understand COVID-19, we consider this the best case scenario. That first arc, we've had over 50,000 deaths in the country, over 500,000 cases. So we're now coming down that first arc, and we're moving into that second arc, monitoring cases, caring for the ill, and then we will be going over a series of arcs until there's treatments widely available, the vaccine is widely in wide use, and we can get to the next normal. The importance of this slide and the importance of this idea is if you as a meta leader understand the arcs of time, you recognize that the decisions that you're taking, the actions that you're putting into place will guide the trajectory of that arc. We also have a worst case scenario slide, I didn't include it here, where, for example, we open up too quickly and the next arc has even a higher level of cases. And that makes it even a more complex scenario. So the decisions and the actions taken by leaders can guide the trajectory of this crisis and certainly the trajectory of other crises, especially, as was said earlier, as we prepare for the hurricane season, tornadoes, wildfires, and floods. These could be crises that happen at the same time, synchrony with one another. So each of them will have their own arc of time, creating a set of challenges for leaders. And if leaders can smartly respond to them, opportunities as well.
Thank you, Lenny, for being flexible there as my audio went out, in and out a little bit.
Not a problem.
I have a little conflict with storms in my area right now. I was the grant maker for CDP after Hurricane Harvey, and that was, as you mentioned, the year that we had Irma, Jose, Maria, and other disasters. Because Harvey and Maria was so big, it was definitely harder to get philanthropic and NGO attention focused on Irma and Jose.
Right.
So I can certainly see where that means there were multiple simultaneous arcs happening, similar to what we already are seeing with what's going on with COVID and the tornadoes in the South now. Regine, let's take some of the leadership concepts that Lenny talked about and explore them a little deeper in the context of philanthropy. CDP advises philanthropy to prepare for disasters. What advice do you have for philanthropic leaders working in these unprecedented times as they prepare for another disaster at the same time as COVID?
Yeah, and by the way, Lenny, I love your multi-arc slide, and I could feel my brain seeking to understand how that would overlay my own community, my own family, and certainly the work that we're undertaking here as grant makers in the space of COVID-19. So that was a really great visual. Thank you.
Thank you.
I'm literally sitting at my desk, and I am surrounded by notes and things that I had printed out in preparation for the types of questions I knew that Sally would ask of me. And when it all boils down to it, I think for foundation leadership and grant makers writ large, now is really the time for us to dig deep as leaders, just as Lenny had talked about. But really, the advice that I have is quite simple. First, really, and I think I have a slide. Yeah, there you go. You know, what to do in case of emergency, right? Is something that we often talk about. And first and foremost, you need to have your plan and relationships well developed before the next crisis occurs. And you already heard Sally talk about the dates and the timing of tornadoes and of wildfires and of hurricanes and floods. And so now is really the time to make those relationships, to really solidify those relationships. If there are disaster responding organizations that you have thought about connecting with, now is really the time. My second point of consideration is to remember one of these threads, which is that disasters disproportionately affect vulnerable population, and in particular, people of color and low-income communities. So we know that and in particular, we know that low-income communities of color in the aftermath of a disaster decrease in overall wealth asset and become even more vulnerable. So everything that we do right now as it relates to COVID-19 and any future disaster, we have to keep our eye on understanding where those vulnerabilities are and what we can do very specifically to mitigate them for any community. I think it's also, judicious to be really careful in your response right now. There are common disaster needs, right? The food security, I'll just list two just for an example. PPE, personal protective equipment, and food security are common disaster needs. And there's opportunities to utilize common grant making approaches, either by partnering with others or topping up financially existing grantees. I often talk about sticking to your knitting, and I should probably use a more assertive metaphor, but I can't help myself. Stick to your knitting. If you're a grant maker who already supports arts and culture organizations, then reach out to them now and find out how they're doing as it relates to COVID-19, and find out what work they're doing to mitigate the potential threat of any future disaster. It's a phone call, it's an email, it's a connection point, and we really, really advocate for that. And then last one, this last bullet here in terms of thinking about policy and advocacy is in truth an area that I'm learning more about. And that is to say, is there an opportunity for philanthropy to be supportive in helping community-based organizations or nonprofit organizations attract, connect, or obtain any local, state, or federal dollars that are coming, from the federal stimulus bill, CARES Act, or any other funding streams that have potentially not been fully accessed or yet to be released? That's something that my team and I are investigating of the how to make that happen. So I'll just stop on this question, Sally, by repeating where I started, which is we've really all of us have to dig deeper as philanthropists than we've ever dug before.
I've seen a tremendous response to COVID from a range of donors, from individuals to government, but I've also talked to well over 100 different organizations based in the US responding at the national and international levels. There are thousands more local organizations and groups in other countries that are responding. I have to wonder, how will we afford a major hurricane or other large-scale disaster? Regine, what does the data tell us? Is the money there for response and recovery?
Yeah, I mean, such a good question. And I also, I'll start, I want to start by saying that I also chatted with some of my friends over at FEMA. And I kind of was like, okay, you guys, how, given the predictions and given all that you're already doing with FEMA as it relates to the tornadoes that have already occurred and COVID-19, I was like, how are you guys doing? And is this going to work? And they let me know that, absolutely, they're currently responding to the COVID-19 pandemic, but they're also concurrently preparing to respond to other disasters, including the floods, tornadoes, hurricanes we've already talked about. And some of the, kind of quote unquote standard preparedness activities that they regularly engage in at FEMA are still occurring, but they're really doing them in new and different ways. So they're preparing a second NRCC to use in the wake of COVID-19. That's really in the interest of employee safety. They're using all of the different web platforms that we're all using as newer ways to communicate together. And they're reaching out to both their internal and external partners in new and different ways to really coordinate those recovery plans. They over at FEMA, again, friends over at FEMA, like us here at the Center for Disaster Philanthropy, very much believe that all disasters are local. But they really believe that it's going to be even more so with community-based organizations on the front lines. And in addition to community-based organizations, they also talk to me about community foundations and how community foundations have, a really big role to play right now, and have the opportunity for big impact at the home base. Specific to the money question that you asked me, Sally, as of April 20th, right? So this is a week old data, you guys. But Candid, our colleague, used to be Foundation Center and GuideStar, now merged into Candid. They've tracked 545 funders. I can't say this without giggling. 1,242 number of recipients, 1,952 total number of grants, and a total of over $8.3 billion in philanthropic giving just to COVID-19. And later on in the presentation, I have a link to our mapping platform that we share with Candid, and it has a direct link to show you where all those COVID dollars have come from and where they're going to. So in a week, that amount has changed again dramatically. I think it's up to 8.6, but if somebody on my team wants to correct me at a later time, they can. So that number is really, really going up. And of that amount, U.S. foundations have donated $1.7 billion, and that includes public charities. And so without the public charities, it includes $1.5 billion. So I'm going to show you in the next couple of slides that in relative comparison to quote unquote usual philanthropic giving for disasters, this COVID-19 philanthropic giving is off the charts. So if you could hit slide forward for me. So, okay, so you'll see the header here. This is relating to 2017 grant making. So when you see 2017, you should think Harvey, Irma, Maria, Mexico earthquakes, and California wildfires. We know that in 2017, 2,544 donors gave $504 million. So this is just foundation giving. So when you think, I mean, honestly, 504 million is also in and of itself an astounding number. But to think that already, almost four full months into the year, to think that philanthropic giving is basically triple, if not, I'm not doing my math right, more than triple what was given in the entirety of 2017. It's pretty crazy. I'm trying not to use the word unprecedented because we're going to burn that word out. But I do also want to call your attention, I guess this color is teal here, that shows storms, and that the vast majority, 65%, went to natural disasters. Out of that, the largest majority went to storms. So that just really reflects the 3 hurricanes. I'm in the next slide, show you a little bit. This is our foundation funding trend. So this is our longitudinal data that show total amount, number of grants, and number of foundations in those 5 years that were active in disaster giving. And you'll see the largest amount was given first in 2014, excuse me, the second largest amount was given in 2014, and that reflects 2 single large grants that were given to the Ebola outbreak. And then you see 2017, we came in much, considerably higher than that, again, owing to the Harvey, Irma, Maria wildfires and earthquake that occurred. The number of grants, again, certainly 2017 was our largest year to date. We're now seeing that we're well over that through the data that we're receiving from Candid. So the dollars are there. I also want to say one more thing, which is that some research show that over 80% of all dollars that rest in DAFs, or donor advised funds, have yet to be allocated, and that number is also quite a huge number. And so if we all take the mantra that I suggested earlier of digging deep and bringing our leadership to bear, we know then that there would be funding available to support not only COVID-19, but also any co-occurring disaster that we may see shortly.
Regine, what are the equity considerations in this work? How do we protect our most vulnerable communities during another disaster when they're already reeling from the pandemic?
Yeah, can you slide forward for me? So, first I want to say that when we at the Center for Disaster Philanthropy started talking about COVID-19, we couched it as, this is a disaster that's affecting all of us. Not one person is unaffected by COVID-19. And what we quickly realized, thankfully through other smart people who were collecting data, was that, yeah, we're all affected, right? I'm currently in my house, and there are more people in my house right now at this time of day that are normally in my house. And it's a little bit louder and a little bit crazier, and we're going out less. So yes, my home is affected, but there are disproportionate effects given this disease. So I turned, to the source of all sources as it relates to equity considerations. I went over to NAACP because we learned, just over the past few weeks, that African Americans and other people of color are getting COVID-19 more frequently, and their case fatality rate is higher. So we also know that from NAACP that racism has increased. Certainly we saw that at the beginning toward Asian individuals and now Asian and Asian American populations. As I mentioned or I alluded to, we know that immigrants, incarcerated people, older adults, people with disabilities, people with special health needs, and others are at an added risk of exposure and other complications. We know that our frontline workers are making choices every day between risking their exposure and risking their economic health, we know certainly that we've got concerns and considerations as it relates to census and voting, and that as public outings dwindle, we're going to see lower numbers of participation in both of those large events. And, you know, there's an environmental concern that, again, I'm so thankful that our colleagues over at NAACP raise, is that while we are, you know, furiously making sure that our environment is clean and germ-free, we're also exposing individuals, at-risk individuals, to toxic cleaning chemicals. So there's huge equity concerns and considerations. I'm sorry, I hope I'm not droning on, Sally, but I'll do these really quickly. I mean, you know, anybody who still is in school, they're risking additional exposure. We all know the negative news, or I don't know if it's negative news, but we all know that there's a total lack of accessibility to testing kits, and that the numbers that we're hearing are unlikely reflecting the whole picture of who has had or will have coronavirus. The quarantine policies and practice, I'm again harkening back to the ARCs that Lenny shared with us. There's, you know, differing information by states, differing information by communities. Implementation of openings certainly would benefit from some clarity in many communities. And, you know, we've also seen COVID-19 be the rationale to justify restrictive immigration policies, and misinformation that's coming from many sources is really not helping this outbreak. So again, I'll close here by saying these equity concerns and considerations are impressive and worrisome.
Regine, building on that, it seems to me that we're going to have to imagine a very different response and recovery. And as Lenny mentioned, with the arc of time, we're going to be in different places of each arc. How can philanthropy best partner with NGOs and other grantees to help them do work in this new world?
Yeah, I think I have a slide to answer this question too. Oh, look at this. You know, I'm again in the spirit of let's be practical and let's be actionable, and let's do things that we can implement. You know, first of all, if you haven't already, connect with all of your existing grantees. And quite frankly, if you connected with all your existing grantees a month ago, then take this time to email or call them again and check in. I guarantee you things have changed. As I alluded to before, the link that's here on the Measuring the State of Disaster Philanthropy map will take you to COVID-specific data, so you can see where those billions of dollars are going. I know many of you on the webinar today represent regions or community foundations. So take a moment to assess your own region or philanthropic catchment area's risk profile. I spoke yesterday with some individuals in the philanthropic community in Wisconsin. So using them as an example, they are, knock wood, clearly not, you know, susceptible to a hurricane risk, but their community should be thinking about what flood risks can be mitigated, and what flood risks can be mitigated, what relationships can be established and forged now before rivers crest and disaster occurs. And then looking internally at your own philanthropic organization, look at what human, financial, and technical resources you have to give in the event of a co-occurring disaster. Is it convening? Obviously, we know convening is going to look differently. Is it the loaning of staff? Is it volunteer assistance? Is it additional funding? Is it some suspending of grant timelines or reporting timelines or unfettering of a particular grant? 3 other practical resources for funders. First, we have our Disaster Philanthropy Playbook. It's divided into strategies and into different sections so that you can look at housing, the needs of older adults, mental health needs, and overlay that on top of this COVID-19 plus a co-occurring disaster. I can't lie, I was part of writing the basic tips for disaster giving, but it is one document that I have printed out as a reminder to keep it simple and, and reflect upon your own mission when you're working with disaster grantees. And then lastly, the link that was sent to us by the Center for Nonprofit Excellence, it's just astounding. It's literally a Google Doc, and it lays out all of the different ways that the nonprofit community can connect into financial resources from local, state, federal sources, It offers advice on self-care, mental health needs of organizations, continuity of operations. It is an astounding resource that's been collected by our friends over at the Center for Nonprofit Excellence. So well worth a read.
I have a question for both of you. Lenny, let's start with you. On a very practical level, what are 3 things philanthropic leaders should be doing to prepare themselves and their teams for the next 6 months? Lenny?
Can you hear me now?
Yes.
Yes. So first off, when you understand a crisis evolving up and over an arc of time, you recognize that you can actually guide the shape of that arc. Government leaders can help to guide that shape, philanthropic leaders, business leaders. So it's important to recognize that we're not simply victims of this crisis. What's going on right now is a cunning virus versus an intelligent species. So we have to be smart about seeing how to guide that arc. The second thing is that if you see that, you start to anticipate what will be your future needs. I was at the CDC in late January. There are 5 cases in the United States. At that time, we could have anticipated that we would need PPE, that we would need more testing, that we would need more ventilators. It's important to anticipate what lies ahead, because if you get that right, you can meet the need before we're at crisis mode, and thereby you can contribute to shaping that arc. And then it's critically important then to adapt. What's going on with different populations? And then how do we adapt the giving? How do we adapt the support to the different populations that are being very differently affected as the arc of time emerges? You recognize that even different communities and different countries are experiencing different arcs of time. It's not the whole world on the same arc at the same time.
And Regine, what are your 3 steps? And are there any resources beyond what you've already shared that you can share to support them?
I have 2, and by the time I finish the second, I'll have a third. But the first I would say is look at the list of your existing grantees and determine which ones are supporting the most vulnerable. Are any of your grantees supporting older adults, child care centers? Are any of your social service organizations? And look to see if you can extend additional financial resources to them, or if you can free up some of the ways that they've initially been programmed. The second would be to connect with your finance team or whoever in your foundation handles investments to see if you can move your minimum contribution northwards of 5%. I know that's such a difficult conversation to have in light of the economic downturn. But in that same spirit of digging deep, the need to look beyond that 5% is just so critical. I also, we in the disaster space have some really corny sayings, one of which is it's a marathon, not a sprint. So I think my third practical advice would be for everybody who's working 60, 70-hour weeks, do whatever you can to preserve your own momentum. Dial back your hours, don't work on Saturday, because this, as in Lenny's slide, this is the new normal. And if we have an overlay of a co-occurring disaster, we have to make sure that we in philanthropy collectively have the stamina to navigate that.
Good points. Now we're going to move to the Q&A portion, and we have a few questions. As with prior epidemics, there appears to be a hesitancy from funders to act, given the amount of uncertainty that remains about where the needs will be greatest. What is your advice for them? Lenny?
This is the problem that we're a question we're getting from leaders in every different sphere, and what we would love to know and what we would love to have is a sense of predictability. If I do act A, then there will be consequence B. And right now, because of the novel nature of this crisis, we don't know exactly what action will lead us to the next response. So even though it's important to anticipate, it's really important to be thinking very widely. That's why we're encouraging people to have this meta view, because if you're looking at it very widely, you're going to discover options, you're going to discover answers and resources that you might not otherwise have been paying attention to. So this is an area in which we really need to be thinking in a very creative and adaptive way, because we don't even know at this point what the trajectory of this crisis is going to be.
Regine, do you have an answer for that? Beyond what Lenny?
No, Lenny's was so good, I'm going to stop.
Thank you.
Regine, do you think it's time for us to broaden our definition of resilience?
I think I could make the case that we already have, and that we are walking the walk of a broadened definition of resilience, and that our collective attention, our collective action of staying home, redesigning our lives, redesigning our workplace is a demonstration of resilience. I think that if you were to talk about, fixed assets such as community centers, universities, schools, then yes, there likely is a cause to broaden that definition to weather this type of, Lenny, what did you call it? You called it this cunning virus.
Mm-hmm. May I provide an answer for that as well?
Definitely. I was going to ask you to do that.
Oh, there you go. Well, what's really interesting when we step back and look at this is that there are a number of people who have predicted that we would have this pandemic for many years. There was a whole group on the National Security Council at the White House, led by Carter Metzger, who's getting a lot of very, very well-deserved media attention now, that was talking back in the Bush administration, and there were continuing conversation in the Obama administration. So from a policy perspective, there's been talk of this pandemic. John Barry wrote that extraordinary book about the 1918 pandemic. So this is not a surprise. And now that it's happened once, we have a responsibility. Our generation has a responsibility to learn these lessons and then to prepare either our future or the future generations for the fact that a pandemic like this can happen again. And when it does happen again, we should not have the kind of response in the very beginning, certainly in this country and around the world, that we had this time around. So I think there were a lot of doubters about a pandemic before we got to this point right now. No one should doubt at this point, and we really, really need to prepare ourselves and future generations for the fact that this could come again, so that we're not left in the situation in the future that we were in this time when this crisis began. That's resilience.
Thank you both. Regine, I think this one might be for you. What are your recommendations for doing philanthropic giving in a way that won't be duplicative of government programs?
Oh, that is a good question. And that is something that if you have examples, you're more than welcome to email those to me. I will say that from my understanding, the federal government response is unfolding as we speak, as it relates to PPEs and the way the Stimulus Act will be implemented in its entirety. So I'm trying to think of an example that would be helpful. Sally, do you have an example that would be helpful?
May I jump in? This is Leonard.
Yes.
Right now, there's so much that is being brought to the government. The government is sort of like shooting the side of the barn, throwing out a lot of money, doing it very, very quickly without the kind of care and attention and precision that usually goes on with government grant making. Some of it will hit perfectly, some of it won't. And I would think that people in this community would have a much more precise notion of where some of their needs and have a more sophisticated understanding of where some of those needs are than the government, which is right now just pushing out a lot of money, pushing out a lot of resources, trying to fill in where there are clear gaps, responding also to where the media has identified gaps. And I would imagine that, given the expertise of this community and the precision of this community, you would have a much wiser way of understanding where those needs are, and thereby a much more precise way of providing support where it's needed.
Lenny, I'm going to toss a question back to you. So let's look at the PPP, the Paycheck Protection Plan. I clearly cannot say that.
Right.
To me, it seems that if an organization that you're affiliated with in a grant maker role, you wouldn't want to duplicate that particular scope of work, right? So if organization X actually gets funding from the PPP, you then would not want to cover salaries for that given period of time. Fair?
Right, exactly.
Yeah.
Right, and so that's what they threw. It was like throwing a lot of money at the problem, which is great, and it's really, really helpful. Thank goodness it's being done. But you can be much more precise of saying, well, that was already funded, but this piece over here wasn't.
Right.
Yeah.
Regine, what historical percentage of CDP grants are funded in the continental US versus internationally? And do you anticipate shifts in that giving with the current global crisis?
I love this question. So when CDP was founded back in 2010, we very much considered ourselves 50-50 domestic international, or we considered ourselves a global organization. That said, when we really kicked into high gear as a grant maker following Hurricanes Harvey, Irma, and Maria, those dollars were very clearly domestically driven. And Sally, you know better than anybody, given that you directed our Harvey Fund, that $15 million in Harvey, $15 million was directed exclusively to Texas. So I would imagine that the percentage of CDP grants domestically focused would be 80%, whereas internationally focused would likely be 20%. And those dollars went to the Philippines for Typhoon Haiyan, the Nepal earthquake, flooding in Kerala, cyclones in Mozambique, and several other disasters in countries worldwide. We've already shifted our grant making as it relates to COVID-19 to be very global in nature. And we've funded organizations that have either a national level presence here domestically or a multi-country presence internationally. So I think that, I don't know if the percentage is going to shift dramatically, but as it relates to COVID-19, I bet you're going to see us fund 50-50 domestic versus international. I know that another question came in, and I'll just, I'm wondering if Sally had a sound problem. So Lenny, you and I are going to take it for a heartbeat here. Okay. It's about funder affinity groups banding together for the most effective and collaborative responses. And I have to say, I love PSOs, so philanthropy serving organizations. So, when I think about funder affinity groups, I think not only about those that are issue-based, funders that are issue-based, as well as funders that are regional. And I'll go back to the Wisconsin folks that I was chatting with yesterday. They are bringing leadership together around their state to focus on what their state needs. And we know that's happening in the Southwest, in New Jersey, in New York, and in so many other regional locations where it's really critical that regional leadership comes through. Have you seen any of that funder affinity group work coming through, Lenny?
Yeah, and the advantage of that is that here are people who have expertise and they understand their local situations, and likewise, every one of the humanitarian agencies and the community-based agencies are going through such stress right now that the advantage of that is that you already know the terrain, you know the people, you know the relationships, you've got those relationships, you understand the work that's being done, And through that, it's a marvelous platform in which to amplify that work and ensure that that work is continued.
I'm back.
Okay.
Thank you everyone for your patience with the storms here in Texas that are messing with my Wi-Fi a little bit. We have a question here in our Q&A box from one of our great Community Foundation colleagues, Brian Fogel. Brian wants to know, how do we balance the needs of now for vulnerable populations, et cetera, versus the sustainability of nonprofits in the future? So many have had their main fundraisers canceled, giving will be down in the recession, et cetera. How do they survive? And as a funder, what is our role to help them?
I'll take a first stab at that question, Sally. And I think that also connects with a question that Cornelia Carey raised in terms of, budgeting for now, but preparing for later. I learned from a report that I read put out by Fidelity that 25% of donors plan to increase their donations this year, and 54% of donors plan to maintain their giving levels. So to me, knock wood, that demonstrates that there's a willingness on behalf of funders to bring more money to bear. That said, Brian, I have a huge concern for community-based organizations that indeed have lost significant revenue from events and fundraisers. And that's where I think that it is going to take the Stimulus Act and any funding from the Stimulus Act that will go to nonprofit organizations, coupled with the arguably much smaller amount of dollars that will come from private philanthropy to that. In terms of Cornelia's question, again, if I'm dovetailing these okay, I'll just share with you our experience, which is we, again, under Sally's leadership, have just awarded 3 rounds of grants. And we did those almost every 10 business days, which is pretty, that's a pretty quick pace. I think the fourth round of, I know the fourth round of granting will also keep up that same kind of 10 business day pace. But then our 5th round of grant making, we're going to start to really slow it down, look at what the long-term trajectory looks like, and be really thoughtful with potential grantees about how to allocate those scarce resources, because ultimately even 1.7 billion, domestically raised, that is still ultimately a scarce resource.
I'll answer the question this way. Let's just say we could go back in time a week before Harvey, and we were having this conversation, and someone would say, well, we're going to have these 4 hurricanes in quick succession. Knowing that beforehand, how would you fund different communities? How would you support different agencies? What would you do if you knew that you had these different hurricanes coming ahead? How would you allocate your resources? So you could almost look then at the future trajectory of COVID-19 from here. You know that there are going to be a series of arcs of time that we have to go through, and you are going to have to allocate resources over that period of time. So knowing that, then how do you want to figure out what you're doing in the now? And then how do you want to anticipate what comes down the road? Because at the end of this, going back to the question of resilience, we want these organizations and communities to be sustained, and we want individual families sustained. So how do we think about all that is going to lie ahead between now and the day when all of us are vaccinated, when the COVID-19 crisis is behind us? We know that there are going to be a series of arcs of time, and we know that the needs through each of them are going to be critical.
Some of the areas of most immediate visible need and impact with other types of disasters like storms or fires or natural disasters of other types are hyper local. Small town food banks, contact tracing, that sort of, those are local responses. How do big national, international funders adjust and quickly raise their flexibility to respond that way? Who wants that one?
Eugene, why don't you go first? I'll go second.
Okay, I was going to say, Lenny, go first because I'm not actually sure I understand the question.
Okay, well, okay, I'll give you my answer. Let's see if this works. You know, what's the difference in just being a student of crises? The difference between this crisis and every other crisis that we've ever studied and or lived through is that crises tend to be local or regional, which means that there are people outside of the crisis area who can provide support to the people who are in the midst of crisis. We're talking about a hurricane happens in a specific area, or the Gulf oil spill affected a particular area, and those from the outside could come in. What's unique about COVID-19 is every single person, every family, every community, every organization is being affected by this, everyone differently. So this is a different model than we've experienced before. And because it has this universal quality, it creates a whole new set of challenges for leaders, for philanthropies, for community agencies, for individuals, because we're all both trying to cope with our own response to it as well as to help other people. And we're all in the middle of the hot zone, so to speak.
Thanks, Lenny. I'm gonna give Regina a reprieve on that one because we're running out of time. As we begin to wrap up, I'd like to summarize some of the discussion and provide the audience with some key takeaways from our conversation. Stick to your knitting, which I love, by the way, Regine. Dig deeper than ever before. Plan your response before it is needed. Focus on diversity and vulnerable communities. Engage in policy advocacy. Leadership is key to managing the crisis. As our panelists have shared, there will be ongoing needs to assist with recovery efforts over an uncertain length of time. CDP has many resources, including our COVID-19 Response Fund, devoted to disaster philanthropy that can assist you. And our staff is always available to provide guidance. You can find more information about all of our work at disasterphilanthropy.org. To those of you who may be planning disaster response funding, CDP has additional information in our Disaster Philanthropy Playbook. You can find this resource at disasterplaybook.org. This webinar is a series of 7 webinars taking place over the next 3 months on the 2nd and 4th Tuesday of each month at 2 p.m. Eastern. The next webinar is on May 12th, and the topic will be COVID-19, place-based grant makers, and investing in local communities. Our speakers will be Carmen James Randolph from the Greater New Orleans Foundation and Maureen Lawless from the Funders Network for Smart Growth in Livable Communities. In order to respect everyone's time and to keep this to an hour, unfortunately, that is all the time we have for today's webinar. Thank you to Regina and Lenny for taking time to share their insights. Special thanks again to Verizon for hosting this webinar and to our co-sponsors Interaction, National Voluntary Organizations Active in Disasters, Council on Foundations, the National Center for Family Philanthropy, Grantmakers in Health, Grantmakers in Aging, United Philanthropy Forum, and the Funders Network for Smart Growth and Livable Communities. And thank you to everyone who joined us. As the webinar ends, a brief survey will pop up. Please take a moment to share your thoughts. And if you have any questions that were not addressed during today's webinar, and I saw several of them, you may email them to me at sally.ray@disasterphilanthropy.org. Thank you to everyone who joined us today. Please stay healthy and have a good afternoon.